Okay. Hi, my name is Elia Campos. I am a student at San Diego University. I am in the DMP program with emphasis in nursing informatics and data science. And I am here with a really great and amazing professor. Would you like to introduce yourself, Dr. DuBose?
Sure. My name is Dr. Bree DuBose.
Okay. And what is your title currently?
I am currently a Lean Six Sigma black belt at a healthcare organization in town, and I can explain what that is if you're not familiar with the terminology. And then I am an adjunct lecturer professor at the University of San Diego and San Diego State University.
Thank you. Yeah, if you could kind of emphasize or go over your Sigma Black Belt just so that everybody is aware of what it means.
Yeah, whenever I tell people that's my job, sometimes they get really excited and they think that I perform martial arts full time as a living, but that is not what I do. Although sometimes I'm a dork and I joke that I fight waste and inefficiency. But a Lean Six Sigma black belt is the combination of two methodologies. One of them is lean, which is improving efficiency through the decreasing waste in our processes. And then the other is Six Sigma, which is decreasing defects through statistical analysis and best practices. So, as a Lean Six Sigma black belt for a healthcare organization, I am part data analyst, root cause analysis for problems and defects we have, part project manager for implementation, and then part facilitator. So I work full time for a healthcare organization here in San Diego, helping support large transformation projects across the system that either improve quality, safety, or just be able to make a better experience for both our providers, our patients, and our community.
That's a really impressive. Thank you so much for
Oh,
sharing.
yeah, you're welcome.
Um, and so as far as all the work that you have done, um, can you describe a little bit of how all your how everything you've done has led you to where you are currently?
Yeah, I always really recommend that people explore professions in nursing because I think it's one of the only professions that you can really evolve and grow and shift as you have more life experience. There's seasonalities to life in all things, and I think it's such an amazing profession because you can really capitalize on the seasonality of your own life and your own profession. So I started my clinical experience is all in emergency nursing. So prior to moving to San Diego, I lived in Arizona and I've been a nurse for about 20 years now. All of my clinical experience, except for a very short little stint in labor and delivery and postpartum, has been in emergency nursing. And really early on, in my nursing career in the emergency department, I just really wanted to make the processes better. It wasn't uncommon for the organization I worked for in Arizona that I would leave at 7 in the morning and I would come back to work that night, and the same people would either be in the department or in the waiting room, still waiting to be seen. And we would have to give, blood and triage and send some people to the cath lab from triage because we just really lacked some efficiencies. So really early on in my healthcare journey, I really enjoyed the collaboration with peers and physicians and pre-hospital, and I loved talking with patients and being part of, if somebody goes to the emergency department, even if it's a minor thing, I always say that it gets woven into their family quilt. So even the most minor reasons why somebody might seek emergency care really becomes part of their life story. And I always was really humbled that I got to play a small little part of that. But from pretty early on in my career, I was really interested on what can we do within the confines of our structures and our systems to make the care safer, more efficient, more cost effective. So I got involved in, unit-based committees pretty early on in my career with lean projects and working with consultants. And then when I moved to San Diego, I was at that fork in the road that I was ready to pursue a master's. And I decided that instead of going a traditional MSN route, I went into the MHI route. So I have a master's in healthcare innovation, which really helped me explore bringing in best practices and ways of thinking from other industries on how we can improve healthcare and be more innovative in the care that we're providing. And then after my master's, there was an opportunity to become a black belt at the organization I work for. So I went and obtained my black belt certification. And then after a couple of years of that, I got the itch to want to grow and evolve and have a new season. So I went back and received my PhD from University of San Diego. And then now that has opened the door for teaching opportunities. I love being on campus. I love coordinating and collaborating with students. I'm a big believer in my boss always says we rise by lifting others. So I'm always really honored to play a small part in helping lift students and help shepherd them through their journey. So my PhD really opened the door for me to teach in a full-time capacity at a couple of universities, and I just adore it.
Okay, thank you so much. I love that you how you describe each one of your participations in healthcare as your season in
Yeah.
life. I had never heard that before, but that's really nice. I love it. Um, as far as everything you have done in leadership, what would be some specific issues that you feel like you have addressed and you've made a contribution to?
What's probably one of the most meaningful contributions for me was my PhD research was on suicide mortality of emergency department patients. And it really was the accumulation of a lifetime of experiences. So, very early on in my emergency nursing career, um, people in psychiatric distress was just part of our patient populations that we helped take care of. And I began advocating for kinder, gentler, more inclusive care of these patients. Even as a very novice nurse, it wouldn't be hard for me to get up on my soapbox and advocate for better care and treatment of these patients. And then, like most individuals, most people have been touched by suicide by somebody close to them. So unfortunately, my stepbrother died from suicide, and I've had a lot of friends that have died from suicide. So when the opportunity with my PhD arose that I could do was really great about University of San Diego, USD, is that you can choose any topic really within reason that you want to do your research on. I wanted to go back to the emergency room and I wanted to do something that I felt really passionate about. So for my dissertation research, I looked at 4 years of adult patients that came to one of our emergency departments. And then I cross-reference those patients through the county to determine who had died from suicide after they had been seen in the emergency department, and then looked at different variables that could have contributed or were associated with an increased risk of dying from suicide after being seen. Now, this was we always say when you're mentoring and helping students through their DMP or their PhD, you're not there to really boil the ocean. You're there to learn a specific set of skills. So, unfortunately, my research wasn't generalizable to the country, but I was able to take my results back to the organization in which I had done the study and share and say, this is what happens to our patients after they leave our emergency departments, and this is the rate of suicide, and this is some of the contributing factors. And we were then able to implement universal screening in our emergency departments ahead of the 2025 mandate. So legislation passed a couple of years ago that starting January 1st in 2025, all general acute hospitals will have to screen 100% of patients. But my research was completed in 2021, and I was able to share my research with my organization, and then they were able to implement universal screening ahead of that mandate. So that felt like a love letter to those that I have lost and all those patients that I have seen over the years, and hopefully prevent and be able to connect somebody with resources that's in the psychiatric emergency sooner rather than later.
That's um, that's an extremely important task you've done. I think a lot of us as nurses have come across someone who
Mhm.
struggles, and providing resources is such a vital part um, of what we do. And I'm so sorry for your loss.
Oh, thank you.
I'm,
Yeah.
I'm glad that you put that into a positive and have done so much for others.
Yeah, there was over 1 million patients that I looked at to cross-reference with our medical examiner, and just it was very data heavy as a dissertation is, but it really felt like such a privilege to give like a love letter. Like this was my labor of love to everyone that's lost somebody from suicide or had a patient that's died, and hopefully, if it was meaningful enough to prevent one person from like us asking the right question at the right time in the emergency department that could prevent one death, then all of those hours of research and pivot tables and everything was well worth it.
Thank you so much.
Yeah.
Is there any other um, way that you hope all this will help other people other than, I mean, it's amazing, and it's great, but are there
Yeah.
any other um areas where you would see this helping other than the emergency department?
Yeah, I have a friend that works in the East Coast, and I met with her leadership team a couple of months ago as they were evaluating. They had a Sentinel event where somebody had been seen in the emergency department, and then the day of had died from suicide, and they were looking at exploring universal screening. So I was able to share with them the research that I completed here in San Diego and some of the legislation that's passed here in San Diego. And from a legislative lens, across the country, California leads and a lot of other states do adopt. So I was able to share with them this was the research that I completed on our healthcare system. Based off of other research, I don't think it's unique. There's been countless studies that have shown that a high proportion of patients interact with healthcare providers. With in my research, it was 60 days, but generally they say, within 30 to 60 days, your people are interacting with healthcare providers, and there's an opportunity to do enhanced screening for detection and prevention. So it was great to be able to share and then share the legislation that had passed in California so they could start forward thinking that it wouldn't be unheard of for their state to pass legislation mandating universal screening and it's not just in the emergency department, it's all acute care hospitals, but just ERs are usually the entry point for most inpatients.
That's great. It's so inspiring that as a current DMP student, to know that our project can not only benefit us in
Mhm.
the learning process, but also at a local or even um, throughout the United States, like yours has been helping other institutions. So that's amazing.
Yeah.
Thank you so much for sharing that.
And I encourage the students that I advise that when when you have your results from your EBP implementation, you get to that point where it's kind of, I call it the so what. So what does this mean? Like, what do we do with this information? How can we improve the life of either our providers or our patients from this information? And then when you're sharing your stakeholder report outs, you might have several versions of the same information packaged just a little bit differently, so that way it's actionable. So after I completed my research, I went to multiple stakeholder groups, but how I presented the information to them was just like a little bit different. So when I met with the emergency departments and shared the research with them, I wanted to focus on what proportion of patients, um, in my research, a high portion of patients did not have a primary diagnosis that was related to mental health or substance use complaint. They're there because they had an injury, they had abdominal pain, they had insomnia. So it was a way to share with the emergency departments that patients that come in that could be having active suicidal ideation, that they may not be forthcoming with that information. But then versus maybe sharing that information, with a different stakeholder group, you're going to use a different lens on which you're presenting that information so that way it's more actionable to the group that you're sharing it with. And so when I met with the group from on the East Coast, I shared a little bit about my research, but I shared a lot about the legislation that had passed here and how our hospital was going to be implementing it.
It's amazing. Such great work.
Thanks.
Um, is there any other tips or advice that you would like to give others in this profession, so that we can grow from it or learn from it?
Yeah, I mean, I never say no to an opportunity. Sometimes that means there might be some brief moments throughout the year that I could be spinning a few too many plates. It might feel like a little overwhelming, but I just remind myself that it's short-lived. And you know, seeking ways to improve and grow allows you to seamlessly transition to the different seasons. So I just finished ANA California Advocacy Fellowship a couple of months ago, where I worked with a group of leaders from across the state and some individuals from the East Coast creating an assessment for organizations to distribute to assess their LGBTQIA plus equity in their healthcare organization. So in some areas of the state, we're doing a little bit better on providing equitable care to patients that identify with an LGBTQIA status, but we don't really have a good understanding of what the lived experience is for employees, nurses that are part of the LGBTQIA community. And the thinking is if you are an LGBTQIA plus nurse and you feel well supported, in your organization that you work in through different resources and equity and representation, it just enhances patient care. So my advice is in that opportunity, when it presented itself, I said yes, like I'm going to say yes. And there are some weeks that I was like, oh my gosh, how am I going to fit this all in? But I'm so glad I did because it led to building relationships. And then now I'm helping ANA California with their ballot committee. And so it's a great, just say yes to opportunities. And when necessary, put boundaries in for what you feel like you can deliver.
That's great. And as far as you mentioning that even as a new grad, you would always stand up for your patients and
Yeah.
for their care, what um what advice would you give the next generation of incoming nurses um as far as just doing their best and moving
hmm
in their career?
Have a questioning attitude and always lead with humble inquiry. So sometimes um, I really like this quote, which is advocacy is getting people to see it your way on their terms. So, when you advocate for your patients, if you come from a place of humble inquiry, of help me understand, or this leading with observations and not so much with feelings like maybe you can always go to, I'm uncomfortable with this, but it could be, it seems like maybe we shouldn't just like this patient's alcohol level was, 300 an hour ago. Do we think it's the best decision to discharge them to the lobby, or should we should we wait a little bit? Or you can be artful in how you advocate for people, and the saying is true, you do get more bees with honey than vinegar. So it's about being respectful and humble in your questions. And in my experience, I never regret things I do. I regret things I don't do. So I would be more apt to be regretful for not advocating for a patient than doing it. And just being honest, like I think it was really helpful for my peers in the emergency department if they were to downplay or make disparaging, unfortunately disparaging remarks about somebody that had a psychiatric emergency, to share with them like that could have been my brother. Like he died from suicide. And I know you are a loving, caring nurse and a professional nurse, and you would never treat my brother like that. So pretend that patient is my brother.
Those are such wise words. And I think the nursing profession is such a kind and
Hmm.
loving profession. But with everything that goes on it, sometimes, in the rush of things, I think it's important for us to remember all of the kind things you just said, like uh treating others as if they were our own family members, or
Hmm.
I love something you just mentioned about you attract more bees with honey than with vinegar. I
Yeah.
think that's an amazing saying. Um, Thank you so much for all the positive stuff that you do. Uh,
Oh,
as a professor, I have been able to um, gain a lot from you,
oh, great.
even though it's a hybrid program and we don't have a lot of contact. I feel like I have connected with you because you're such a kind individual. And
Oh,
thank
thank
you
you.
for all your help. And your work is amazing. You're such an inspiration to all of us.
Oh,
Um,
thank you.
I want to thank you so from the bottom of my heart for allowing us to know more about you and the work that you have done.
Oh, thank you. I was really honored that you asked. I have so much respect for you. You produce such high quality work in all of the courses I've had you in. So I was really honored, and flattered that you would be interested in chatting with me in this venue. So thank you.
Thank you. Um, Let me go ahead and